Weeks after closing many of the clinics and medical facilities throughout the Poconos due to COVID-19, Lehigh Valley Health Network and St. Luke's University Health Network are back open for patients, just with a new emphasis on following public health guidelines meant to stop the spread of coronavirus.
There's definitely a new normal everywhere you go, and it includes everybody here at the Lehigh Valley Health Network as well.
LVHN practice manager Joe Panzer showed us around the medical facility here in East Stroudsburg just days after the health network reopened its offices to patients.
We have a couple of signs, one that shows that the room has been sanitized for patients coming in, and then once they leave, when they leave the room, the sign will be flipped.
Panzer explains all the precautions taken to make it safe for the patients and the healthcare staff from start to finish of the visit.
When you come to our offices, we'll ask you to call into the office and let us know that you're here. We'll then have you come inside and we'll take your temperature and ask you questions related to COVID-19, whether you've been sick, whether you have a cough, whether you've traveled out of state.
While Lehigh Valley health practices are trying to use waiting rooms as little as possible, the rooms are now laid out to maintain social distancing. Many of the chairs that used to maximize capacity in these rooms have been removed.
If you should happen to have to wait in the waiting room for a few moments, we do have chairs separated so we keep social distancing, keeping everybody 6 feet apart, and then we'll call you into the office and get you into your room.
Blue tape indicates the line where patients can stay 6 feet away from office staff, whether it's an expectant mother coming for a checkup or someone with family medicine needs.
After every patient leaves, we're wiping down both the patient table, all the doorknobs, doors, countertops, all the things like that. We're sanitizing with our wipes and making sure the room is clean and ready for the next patient.
The same protocols are being followed at St. Luke's Hospital Monroe campus and its doctor's offices. Dr. Peter Favini still stresses the need to wear masks when visiting the emergency room.
We've developed tremendous processes. So we went to universal masking, so masking us and masking the patients. If the patients show up and they don't have a mask, we can mask the patients. So that really reduces infectivity for the ability to get the virus or to transmit the virus.
Here at St. Luke's, waiting to be seen by a medical professional has changed as well. For one thing, there's more space available as there are fewer people seeking treatment. And
then we really have spaced out any kind of waiting. We try to bring people right back to a private room and they're in a separate room by themselves, but we try to space out any waiting. We've even had people who preferred to wait in their car. We would call them in once their room was available.
These doctors, nurses, and medical staff still offer visits by phone, but are now offering face-to-face visits in order to provide the best care possible, while staying on top of the latest guidelines to keep everyone safe. Jim Hamill for the Pocono Television Network.